On behalf of the National Eczema Association, I'd like you to welcome you all to our presentation, Two Important Medicare Changes You Need to Know. According to a recent survey of eczema patients and caregivers, 39% of respondents shared that Medicare didn't reasonably cover all medical aspects of costs of care. We know this is an incredibly important topic, and we're thrilled to have Amy Niles as our presenter today. Amy Niles is the Chief Mission Officer at the PAN Foundation, where she oversees public policy, advocacy, education initiatives, and external relations to drive patient access to healthcare. She also serves on the board of the Specialty Pharmacy Certification Board and is a member of the Center for Value-Based Insurance Design's Advisory Board. And with that, I am pleased to introduce our presenter, Amy Niles.
Thank you so much, Nora, and thank you to the National Eczema Association for inviting me to be with you today. For those of you not familiar with the PAN Foundation, we are a national charitable foundation and health advocacy organization with a mission to accelerate access to affordable, equitable healthcare, and we do that through providing financial assistance, education, and advocacy. Next slide. Some of you may be familiar with the financial assistance that we provide at the PAN Foundation. Through about 80 different programs, we are humbled to be able to provide financial assistance to people who are underinsured to help cover their medication costs, health insurance premiums, as well as transportation expenses. In the 20 years that we have been in existence, we have provided more than $4.5 billion in financial assistance to more than 1.2 million underinsured individuals. Our second pillar at the PAN Foundation is advocacy. We champion policies to lower out-of-pocket costs and expand access to healthcare. The two reforms that we will be speaking about today are reforms that we have long advocated for at the PAN Foundation. And finally, education. We're here to educate patients and healthcare providers about very complex healthcare topics, including the Medicare reforms you're going to hear about today. Next slide. Our reach is broad. We provide financial assistance and education to individuals in every single state of the nation, as well as all territories. Next slide. So let's turn now to the Part D reforms that are taking effect January 1. Next slide. Before we do so, I'd like to just talk a little bit about the timeline for Medicare reforms over the last few years. The Inflation Reduction Act passed into law 6 important Medicare reforms, which started taking effect in 2023. In 2023, we saw Medicare beneficiaries benefiting from being able to access vaccines without any copays or cost sharing. For millions of people living with diabetes, having an insulin cap of $35 per month was a welcome reform. This year, we saw 2 additional reforms. The Federal Extra Help Program, also known as the Low Income Subsidy Program, expanded. Now, people up to 150% of the federal poverty level, very low income, and those with limited resources fully benefit from this program, which means that most, if not all, of their out-of-pocket prescription costs are covered. And finally, this year, we saw the 5% coinsurance in what's called the catastrophic phase of the Medicare benefit be eliminated. In essence, this has meant that people on Medicare have experienced between $3,300 and $3,800 max in their out-of-pocket prescription costs this year. And now, just 8 weeks away, 2 additional reforms will take effect on January 1st, 2025, a Medicare Part D cap and implementation of the Medicare Prescription Payment Plan. For more than a decade, PAN has advocated for these reforms, especially those coming in 2025. In fact, PAN pioneered discussion around what we call smoothing, now known as the Medicare Prescription Payment Plan. So let's dive in to learn more. Next slide. We'll start our discussion with the Medicare Part D cap, and then we'll transition to our second reform, the Medicare Prescription Payment Plan. Next slide. So what is the Medicare Part D cap? Beginning in 2025, there will be a limit on what people on Medicare spend out of pocket for their medications in the Part D, as in David, program. This limit or cap in 2025 is $2,000. This cap does not include medications under the Part B, as in boy, program. The nice thing about this reform is that it is automatic. Other than having Part D coverage, you don't need to do anything. Like you do now, you will continue to pay for your medications at the pharmacy counter unless you opt into the Medicare Prescription Payment Plan, which we will review in just a moment. Next slide. The Medicare Part D cap really benefits everyone, especially people who have been used to spending much more for their medications. Data tells us that by the time we hit June 30th of this year, nearly 5 million people on Medicare had already reached that $2,000 threshold. Next slide. Well, the Medicare Prescription Payment Plan is much more complicated than the Part D cap. To walk you through it, we will go through each of the questions you see here on this slide. Next slide. The Medicare Prescription Payment Plan is a new voluntary payment option for your prescription medications. By law, all Part D plans, both standalone and Medicare Advantage, must offer their enrollees the opportunity to spread their drug costs and payments throughout the calendar year. While the Medicare Part D cap may lower costs for many, the payment plan may make these costs more affordable. Unlike the Part D cap, which is automatic, you need to take action to benefit from this reform. If interested in participating, you need to opt in directly through your Part D plan, either by calling them, and their number is on the back of your insurance card, or visiting their website. The Medicare Prescription Payment Plan only applies to drugs under the Part D program. It does not include drugs covered under Part B. Next slide. The Medicare Prescription Payment Plan is good for patients, but it may not be beneficial for everybody. It is especially beneficial if you have a hard time paying for your medications all at once, or you simply want to budget and spread those costs out. If you have spent $2,000 or more in the first 9 months of the year, this could be beneficial for you. Similarly, if you have had one prescription fill of $600 or more, you might consider this. If you are not eligible for assistance through the federal Extra Help program, you might consider this. Generally, if you cannot get assistance from a foundation like the PAN Foundation, you also might want to consider this. The best time to opt into the payment plan is now, during open enrollment, or at the very beginning of the calendar year. The reality is, though, you can opt into the Medicare Prescription Payment Plan at any time during the year. However, the later in the year that you opt in, the fewer months you will be able to spread your costs. Next slide. CMS, or the Centers for Medicare and Medicaid Services, has developed a standard formula that all Part D plans will use to identify your costs. Generally speaking, and we'll go through some examples in a moment, the bill you receive from your Part D plan month to month will be based on what you would have paid for your prescriptions, plus the previous month's balance divided by the number of months left in the year. The big change when you opt in, you will no longer pay for your prescriptions at the pharmacy counter. Instead, your Part D plan will send you a monthly bill with the amount you owe and when you need to pay by. Payments may change from month to month based on your needs, so it may be hard to predict the future payments. As your needs change and new medications may be needed, their costs will be woven into the formula. What you should know, though, is that by the time you reach the end of the calendar year, December 31st, 2025, you will not have paid any more than $2,000 due to the Medicare Part D cap. Next slide. We will go through 3 different scenarios, in part to demonstrate the complexity of this reform, but also to show how, at the end of the day, it is up to the individual patient to decide if the payment plan is right for them. Next slide. Now, in our 3 examples, this middle column is what the patient would pay without opting into the Medicare prescription payment plan. The third column will be the payments, what the payments would look like with the payment plan. So example 1, Joan spends $500 per month for her medications at the start of the year. She opts into the Medicare prescription payment plan in January. According to the formula, the first step is figuring out what's called the maximum possible payment for January. To do this, we're going to take that $2,000 cap, subtract 0 from it because Joan does not have any prior out-of-pocket costs. So that's $2,000, and we'll divide that by 12 months in the year to get $166.67. Since $166 is less than the $500 she would have paid in January, the Part D plan will only bill her that $166 in January. Now, her remaining balance in February is the $500 from January less $166, which is about $333. And now we're going to add the new $500 from February onto that balance to get $833 and divide that by 11 months remaining to get $75.76 as her payment for February. Notice that without the payment plan, Joan would reach the cap of $2,000 by the end of April. She would not be paying any more after that because she would have reached that cap. Now, we won't go through the remaining calculations with the payment plan, but you will see that with the payment plan, her costs vary a bit from January through March, and then will be around $181 every month thereafter. Well, Joan will need to decide what she wants to do. Would she prefer to pay $500 for 4 months and be done? Or is spreading her costs more affordable? It will be her decision. Next slide. Let's consider George. George spends $80 per month for his medications and also opts into the payment plan in January. Like Joan, his maximum possible payment in January is $166. However, since $80 is less than the maximum possible payment of $166, his Part D plan will only bill him $80 in January. So what happens in February? Well, he has $0 remaining balance, and now we're going to add on that $80 for February. So that's $80, divide that by 11 months remaining in the year, and that includes February. His Part D plan will bill him $7.27 in February. The formula continues, and you see what happens to his payments throughout the year with his payment plan. I think George may decide not to opt in to the Medicare prescription payment plan. Next slide. Let's look at our final scenario. Phyllis pays $4 every month for a prescription. In April, she also has to pay for an expensive medication that's $613. And during April, she also opts into the Medicare prescription payment plan. She has some large costs for medications in July and October as well. For Phyllis, the first month's maximum possible payment, which is for April, is calculated a little differently. We take that $2,000 cap, subtract $12, that's the $4 January, February, March that she has already spent, and we get $1,988. We're going to divide that by 9 months remaining in the year to get $220.89. Well, for April, since that $220 is less than $617, her plan will only bill her $220. Again, we won't go through the subsequent calculations, but notice the variability between April and December. So if Phyllis is concerned about paying $617 in April, she may be interested in opting into the plan. If she's concerned about higher costs later in the year, she may choose not to opt in. Ultimately, it will be up to Phyllis to decide what is best for her based on her budget and her comfort level. Next slide. Fortunately, Medicare's Plan Finder has developed a tool that will allow you to review what the Medicare prescription payment plan may look like for you. Next slide. I know that many of you are likely familiar with Plan Finder. Starting at the Medicare.gov site, you can begin by indicating what kind of plan you're looking for: Medicare Advantage plan, a Part D Medicare drug plan, or Medigap policy. You'll be asked whether you get help with your drug costs, and as you compare plans, whether you want to see the actual costs. Next slide. You'll go on to enter all your known existing prescription drugs, provide your address, and you can select up to 5 pharmacies to compare. Next slide. You'll then see the plans to evaluate, and next slide. And you can compare costs by pharmacy. Notice that there is a highlighted box about the Medicare prescription payment plan on this slide. If you click on that bottom link, find out what your drug costs might look like with this payment option. Next slide. It will take you, based on what you input, a table listing out what your costs may be under the payment plan. Now, unfortunately, you cannot opt into the Medicare prescription payment plan through Plan Finder. That may come in the future. For now, we recommend that you use Plan Finder to help decide if the payment plan is right for you, and then go to your Part D plan to opt in if you decide it is right for you. Next slide. So let's talk a little bit about these bills from the Part D plans. Each bill will indicate what is owed and the date by which payment needs to be made. If a payment is missed, the plan will send a reminder to you. You will have up to 60 days to pay the unpaid balance, at which time, if it remains unpaid, the Part D plan will disenroll you from the Medicare prescription payment plan. You will not be disenrolled from the Part D plan itself. You can always opt back into the payment plan after your unpaid balances are paid. Next slide. Now, opting in is going to be an annual requirement, even if you stay with your current Part D plan 1 year to the next. Of course, if you change plans, you need to opt into the payment plan with your new Part D plan. Next slide. And if you opt in and afterwards you decide it's really not right for you, you can opt out simply by contacting your plan. This will not impact, again, your participation in the Part D plan. Unpaid balances will be owed, and when opting out, you will start paying for your medications again directly at the pharmacy counter. Next slide. So let's review some key takeaways about this somewhat complicated Medicare reform, the Medicare prescription payment plan. This plan may make your drug costs more affordable by spreading costs and payments throughout the year. But as we have seen, it is not for everyone. We recommend that you first explore options to lower your costs, such as the Extra Help Program, Low-Income Subsidy Program, and financial assistance through foundations like PAN. You will be receiving 2 bills from your Part D plan, one for your premium and the other for your drug costs. If you have difficulty affording these costs, we recommend that you always pay your premium bill first. This reform comes with changes for the Medicare beneficiary. First, you have to take action to participate in this program. You have to opt in through your Part D plan. And secondly, as we have discussed, this will change how you pay for your medications. Next slide. So let's look at these two reforms kind of side by side. Does the reform lower my prescription costs? Well, the cap of $2,000 certainly puts a limit on what you spend and may very well lower your costs, especially if you're used to paying much higher costs. The payment plan does not lower your costs, but it may make them more affordable. Who's eligible? Well, for the Medicare Part D cap, anyone with a Part D plan is eligible and can benefit from the cap, whether it's through a traditional Medicare plan or Medicare Advantage. With the Medicare prescription payment plan, anyone enrolled in a Part D plan can opt into this program. What actions must I take to benefit? Well, for the cap, nothing. It's automatic. Since the payment plan is voluntary, you need to call or visit your plan's website to opt in. And how will I pay for my medications? With the cap, you will pay at the pharmacy counter. If opting into the Medicare prescription payment plan, you will be billed monthly by your Part D plan. Next slide. And one more slide. So we know that there is a lot of education needed around both the Medicare Part D cap and the Medicare prescription payment plan. In fact, just a couple of months ago, we conducted a national poll at the PAN Foundation and unfortunately found that 9 out of 10 people on Medicare are simply not aware that these reforms are taking place January 1, 2025. So at the PAN Foundation website, which is panfoundation.org, we have expanded our Medicare Reforms Education Hub, which has a lot of information about all the reforms, but especially the two reforms that we have been talking about today. We have created booklets in both English and Spanish, as well as short videos in English and Spanish as well to explain both the Medicare Part D cap and the payment plan. We are honored to be conducting webinars with organizations like the National Eczema Association and many others, because at the end of the day, we are trying to reach as many patients and healthcare providers with information about these reforms. Next slide. So for additional resources, because I know we have covered a lot of information today, and you may forget some of the information or just want to call upon some additional resources for more information, certainly Medicare.gov is a resource to you, either Medicare.gov website or by calling them toll free at 1-800-633-4227. We do encourage you to visit the PAN Foundation Education Hub at panfoundation.org/reforms. Many people are not aware of the State Health Insurance Assistance Program. By contacting shiphelp.org, you will be able to find individuals, SHIP counselors, who are there to provide free, personalized health insurance counseling and walk you through the complexities of the Medicare program. And finally, if you think due to limited income and assets that you may be eligible for the Extra Help program, we encourage you to visit the Social Security Administration site to start the process there. Next slide. So finally, just want to talk a little bit about PAN's commitment to health equity. Next slide. We believe everyone deserves equitable access to affordable health care, regardless of who they are. At the PAN Foundation, our organization, through our board of directors, have made a very large commitment to both DEI and health equity at the PAN Foundation. This is why we're committed to the following principles as you see here on this slide: providing financial assistance to patients who need it the most, partnering with organizations like the National Eczema Association that work towards health equity, like we do, and advocating for policies that promote health equity and improve access to affordable health care. Next slide. We encourage you to stay connected to PAN. And next slide. We hope that you will stay connected via our monthly newsletter, so we encourage you to subscribe to that. Please visit our website, panfoundation.org, for more information, and certainly connect with us on our social media platforms. Next slide. With that, I thank you again. I thank the National Eczema Association for inviting me to talk about really two historic Medicare reforms that are taking place January 1, 2025. I'm happy to answer any questions you might have.
Great. Thank you so much, Amy, for helping us get a better understanding and wrap our heads around these changes to Medicare Part D. And now I believe we have some great questions that have come in. So I will take a look now and we'll do a Q&A. Of course, if you have any other questions that have come up along this presentation, please don't hesitate to submit them to our chat box now. All right, so let's see. So for our first question, it looks like we have a question around if I am disenrolled from the payment plan, will I not be able to access my medications? Amy, could you address that?
That is a myth that I have been hearing a lot about, and it's not so. If you disenroll in the Medicare prescription payment plan, you still are part of your Part D plan and still have access to your medication. You will just not be able to spread your costs throughout the benefit year. You will not be paying your Part D plan directly for your medications. You'll continue to pay at the pharmacy counter, but you will still be part of your Part D plan and still have access to your medication.
Thank you. I also see a question here on the income limits. So can you please tell us the income limits for the Extra Help program for 2025? If you know.
The best place to go for that is the Social Security Administration site, because those income limits are changed every single year to adhere to the federal poverty levels. What we do know is that to benefit from Extra Help, one needs to have income up to 150% of the federal poverty level. And there are different levels, whether you are single or with a partner.
Great, thank you. I'm also seeing a question here. My medication is not on the formulary of any Plan D in my zip code. If I buy it, will a card like Single Care or GoodRx, does that amount of out-of-pocket count towards the $2,000 cap?
So the Medicare Part D cap is covering all medications that are included in the Part D program, and that's kind of the guidelines for the reform. I think what's important to note is that this year, during an open enrollment, which started October 15th, goes through December 7th, there probably could not be a more important year to take time to evaluate one's plan. We know, unfortunately, that 7 out of 10 people on Medicare do not take the time to evaluate their plans. And this is a perfect situation where plans may start excluding drugs on their formulary. We may be seeing increased prior authorizations and step therapy. There might be increased cost sharing. So it is really important to take the time to evaluate the plan to make sure the medications you need are on the formulary. These are what we are in the patient advocacy community talking a lot about. We refer to them as potential unintended consequences of the Medicare reforms, because The Part D plans have increased responsibility, increased financial liability. So we're a little bit concerned that some of the costs are going to start shifting to patients and access will be more difficult. So take the time to review through Plan Finder your plan, compare it with others, and find the plan that can meet your healthcare needs and falls within your budget.
Thank you. I'm also seeing another audience question here. Does this, assuming Medicare prescription payment plan, does it affect my ability to receive financial assistance for my medication?
It does not. Generally speaking, if you can get a grant from a foundation like the Pan Foundation, you may not need to opt into the Medicare prescription payment plan. But, I think before you consider opting in, take a look at extra help, see if you're eligible for that, and take a look at the various foundations that exist. And as you know, we are one of several foundations that provide charitable assistance to people who are underinsured. See if you can get a grant. And again, it may not be necessary to opt in. So it's not one or the other, but preferably speaking, try to find grant assistance first. And if you can't, then consider the payment plan.
Great. I also see a question here asking, don't all plans have the same formulary? You're just that.
The answer is no. Every plan decides themselves what will be on their own formulary, which is why it's so important to evaluate plans during open enrollment.
Great, thank you. I see another question here around signing up for the program. Is it possible to sign up at the pharmacy counter, or the point of sale, when I am picking up my prescriptions?
I wish it was. Many of us believe that it would be a logical place to opt into the Medicare prescription payment plan at the pharmacy counter, but that is not in place for 2025. It is possible that it could be in place later on as the program rolls out, but right now, to opt into the program, you have to go through your Part D plan.
Great, thank you. Let's see. Seeing a couple more questions here. Someone is asking, is the $2,000 out-of-pocket cap on generic drugs, specialty drugs, or all of my prescription drugs?
The cap applies to all of your prescription drugs that are included in the Part D plan.
Great. Let's see. Okay, and I have another question here around enrolling and sort of time-wise when they should enroll. Someone is asking, what happens if I'm prescribed an expensive medication late in the year? How does smoothing work in this case?
It's a great question. So what we advise, the best time to opt into the Medicare prescription payment plan is now, prior to the plan year. But certainly, as I shared earlier, you can opt into the program at any point. I think generally speaking, if you have been prescribed a new medication and it's maybe September, you really should look at the benefit of opting in at that point. You may spend less than you normally would at the pharmacy counter, but your monthly payments will be quite large. So generally speaking, later in the year, it's not as beneficial. It's much more beneficial earlier in the year to opt in.
Yeah, I think that's really important to note is just to take a comprehensive look at your expected healthcare costs, and also time of year timing are going to be really important in determining whether this is a good opt-in for you.
Exactly.
Let's see. I think that is pretty much all of the questions that we have. I'm seeing one more here that is just around ways to enroll. I know that you mentioned that there is both a helpline as well as looking at your health insurance, your Medicare card, to find the right ways to access that online. And currently online and via phone are the two methods to sort of enroll. Is that correct?
They are the best methods and probably the quickest way to opt into the program. So either calling your plan, and that number's on the back of the insurance card, but every plan is required to have information about the Medicare prescription payment plan on their website. So I recommend, many of us recommend, call or go online to opt in that through their website.
Great. And I stand corrected. I see a couple more questions come in, so I know we have a little bit more time here, so we will answer those now. So I have a question that says, can they change the formulary during the year, or is it locked in for the whole year?
There are situations, unfortunately, where plans have changed mid-year. Yeah.
Okay.
These are the kinds of practices that we all are monitoring, again, to just learn how the payment plan is rolling out, the successes, where it needs to be improved. But I know on behalf of the PAN Foundation, we want to learn more about how the program is benefiting Medicare beneficiaries, how it may be impeding access to medications, because we think it's really important to provide that feedback back to CMS.
Absolutely. Great. I see another question, which is asking, is there a place I can go to figure out what my cost may be before deciding if I want to sign up for the payment plan? I know you just, but to circle back to this a little bit.
Yeah, the best place to go to figure that out is the Medicare.gov Plan Finder, which, will take a little bit of time to input all your prescription costs, and to identify pharmacies where you want to compare. But that really is the best place to go. It is unfortunate that you then can't opt into the Medicare prescription payment plan directly through Plan Finder, but at least it will be a start for you to evaluate what your costs might be. And then again, if you decide that it's right for you, contact your Part D plan.
Great. Okay. Additionally, I see a question, and I know we've touched on this a little bit. So are there any downsides to participating? If not, why isn't this the default or included in these plans automatically? Know we've touched a little bit on, it might not be the right plan for you. There might be some surprise costs. Is that correct? Or could you touch on sort of situations where the plan might not be for you?
Yeah, it is a great question, and it's really for that reason why it has not been made an automatic reform like the Part D cap. If you're someone who, experiences very, very low costs for your prescription medications throughout the year, maybe you're taking some generics, but you typically have, maybe just hundreds of dollars in costs throughout the year, it may not be optimal for you. Again, if you're eligible for assistance through the Extra Help program, you probably don't need the Medicare prescription payment plan. And as a matter of fact, CMS and Medicare strongly urges that if you can enroll in Extra Help, you do so. That is really your first step. So it really becomes, so there are situations where it simply may not be beneficial, but at the end of the day, it really becomes a decision for that patient to make, whether they want to, spread those costs or not. So that's why it has not been made an automatic reform.
Absolutely. And I know, sometimes there's misconceptions, but ultimately, of course, this will not change the total amount that you're paying through the course of the year. Of course, it just means that you'll pay different amounts depending on if you enroll or not. So that's important to know. It doesn't take the place of financial assistance from wonderful places like Pan Foundation. So
Yeah.
um, all things to consider as you're looking at your choices, but having this education is a really great first step to making sure that you are prepared going into open enrollment season here at Medicare. So
Absolutely.
great. So I think that brings us to the end of our questions. Thank you again, Amy, so much for helping us to get a better understanding of Medicare. And many thanks to all of you for joining us today. You can continue your eczema education with us on our website, nationaleczema.org. You may register for an upcoming webinar or watch a recording of a previous webinar at nationaleczema.org/webinars. And on behalf of the National Eczema Association, I thank you all for joining us.
Thank you so much.